Vaccines. Vaccines aren't only for kids. A number of your childhood vaccinations may need worn off. New vaccines may are developed since you were a teenager. And if you travel, add health care, or have certain illnesses, you will need extra vaccines. To guard yourself and therefore the people you're keen on, confirm your shots are up so far. Vaccines for adults. You're never too old to urge vaccines.
Activate the liking bell,
In fact,
and share.
Sticking to an immunization schedule as you age gives you the simplest shot at long-term health. An ounce of prevention is basically worth a pound of cure, says Evan Anderson MD. Many adults are in danger of vaccine-preventable illnesses. And sometimes the damage is completed after an infection has set in. So having the ability to stop illness is best than trying to treat it once it's set in. If you're unsure of your immunization status, ask your doctor.
Activate the liking bell, and share.
Meantime, here's a number of those you would like to form sure you're up so far on. Flu. Doctors agree your best protection against it's the flu vaccine. Anderson says your risk of getting the flu is cut by about half if you get the shot. If you continue to come down with it after you've been vaccinated, it's likely to be shorter and fewer severe. Who should get it? Everyone young, old, and in between should get a flu shot. But especially pregnant women, people with long-term health issues, and other people over 65. Who shouldn't get it? If you've had a severe, life-threatening allergy to the flu vaccine, or are allergic to eggs, or have had Guillain-Barré syndrome, which causes tingling, weakness, and loss of movement in your muscles. Ask your doctor about whether you ought to catch on. When to urge it, it's important to urge an attempt per annum. Each will last only one flu season because the virus evolves.
Activate the liking bell,
so what worked this year might not work also next year. Typically, people come down with it between November and April, Anderson says. You ought to search for a replacement vaccine batch to hit your doctor's office in late August or September. Tdap. This stands for tetanus, diphtheria, and pertussis, whooping cough. All three can cause serious illness or death. Tetanus and diphtheria cases have gone down 99% since this vaccine was introduced.
Bell, and share.
Pertussis cases have fallen by 80%. Who should get it? Everyone. It's also a safeguard for those most susceptible to the diseases, like people with compromised immune systems. If you're pregnant, it's especially critical to urge the Tdap vaccine. It gives your baby short-term protection against pertussis. Who shouldn't get it? If you've had seizures or an allergy to Tdap, you'll got to avoid it.
Don't forget to subscribe,
when to urge it.
The liking
if you're
bell,
pregnant,
and share.
You ought to get the vaccine between your 27th and 36th week. Your baby will get his own vaccine, called DTaP, once he's born. Everyone should have a booster for tetanus and diphtheria, called a TD, every 10 years, or any time you're exposed to tetanus. If you're employed with or are around infants, make certain to urge your Tdap a minimum of fortnight before coming into contact with them. Hepatitis A and B. These are two viruses that infect your liver. Between 2,000 and 3,000 people get hepatitis A annually. About an equivalent number get hepatitis B. The vaccine will protect adults for a minimum of 25 years. Who should get it? Anyone can get hepatitis A or B, but you're most in danger if you travel outside the country, are a person who has sex with other men, use illegal drugs,
Don't forget to
have a
subscribe,
clotting factor
activate
disorder,
the liking bell,
like
and
hemophilia,
share.
come into regular, close contact with someone with hepatitis A, have a chronic disease. Who shouldn't get it? If you've got allergies to anything within the hepatitis A or B vaccine, ask your doctor. If you're sick when you're scheduled to urge either shot, move the appointment to when you're well. If you're pregnant, ask your doctor before getting the hepatitis A shot. How you get it? The
Don't
hepatitis
forget
A
to
vaccine
subscribe,
comes in 2
activate
doses,
the liking bell,
6 months
and
apart.
share.
The hepatitis B vaccine takes 3 shots. There's also a mixture vaccine that protects against hepatitis A and B. It comes in 3 doses. HPV. This stands for human papillomavirus. The infection it causes can cause cervical, vulvar, and vaginal cancers in women, and penile cancer in men. It also can cause anal cancer, throat cancer, and genital warts.
Don't forget to subscribe, activate the
get it?
liking bell,
The
and
HPV
share.
vaccine is suggested for boys and girls at age 11 or 12 so they're protected before ever being exposed to the virus. However, women younger than 26 and men who aren't yet 21 can still catch on. Men who are in sexual relationships with other men can get the vaccine until age 26. Who shouldn't get it? People that are allergic thereto or are pregnant. How you get it? The HPV vaccine comes in 3 doses.
Don't forget to subscribe,
Your doctor
activate
will
the
offer you
liking
the
bell,
second shot a
and share.
month or 2 after the primary. You'll get the 3rd dose 6 months after the opener. Pneumococcal infection with this bacteria can cause pneumonia, meningitis, blood infections, and death. There are 2 vaccines for it, PCV13, called pneumococcal conjugate vaccine, and PPSV23, pneumococcal polysaccharide vaccine. Who should get it? Your doctor should recommend this vaccine
Don't
once
forget
you
to
switch
subscribe,
65.
activate the liking bell,
If you
and
are at
share.
least 19 years old, you should also consider it if you live with chronic illness, have sickle cell disease, have a cochlear implant, have a transplanted organ, have HIV or another illness that affects your system. You're also at higher risk of getting the disease if you smoke. Who shouldn't get it? Those that know they're allergic to the vaccine. When you should get it?
Don't
The
forget
CDC
to
recommends 2
subscribe,
pneumococcal
activate the
vaccines
liking
for all
bell,
adults
and
65 years or older. You should receive a dose of PCV13 first, followed by a dose of PPSV23 a minimum of 1 year later. Measles, mumps, rubella. The MMR vaccine, as it's called, protects against all 3 of those highly contagious diseases. The number of measles cases in the US is on the rise. This is because more and more people aren't immunized.
Don't forget to
Who should get
subscribe,
it?
activate
If you were
the
born
liking
after
bell, and share.
1957, haven't gotten your MMR vaccine, and haven't had measles, you ought to see your doctor about getting the shot. It's also good for college students, teachers, healthcare workers, people who travel outside the US. Who shouldn't get it? If you're pregnant, have HIV or AIDS, are taking medication for cancer, or have a blood disease, avoid it.
Don't
Also,
forget to
if you've
subscribe,
had another
activate the
vaccine within
liking
4
bell,
weeks,
and share.
recently had a transfusion, or are ill, you'll got to delay your shot. How you get it? It comes in one dose, given by your doctor. Chickenpox. Kids get this vaccine as part of their routine checkups. But it wasn't around before 1995. Now, the amount of individuals with chickenpox is at an rock bottom within the US. Who should get the vaccine? If it wasn't around once you were a toddler, you ought to believe getting it,
and
especially if you work in healthcare, work or live with children, are in college, work in a jail or prison, are in the military, are of childbearing age, travel to other countries. Who shouldn't get it? If you're pregnant, wait until 1 month after your baby's born. Talk with your doctor first if you've had a blood transfusion.
Don't forget to subscribe,
HIV, AIDS,
activate
or cancer.
the liking bell, and
You're
share.
taking medicine for any of the above diseases. How you get it? The vaccine comes in 2 doses. Your doctor will give them to you 28 days apart. Shingles. Its actual name is the herpes zoster virus. The vaccine for it's been around only since 2006. It's reduced shingles cases in the US by 51%. It also protects against a condition called post-herpetic
Don't forget
neuralgia.
to subscribe, activate the
That's a
liking bell,
complication
and
that
share.
brings burning pain after the symptoms of shingles go away. Who should get the vaccine? Adults older than 60. You should have it, albeit you had chickenpox, which comes from an equivalent virus as shingles. You should also have it if you've already had shingles. Who shouldn't get it? If you're allergic to gelatin or the antibiotic neomycin, you should stay away from it. Don't catch on if you're pregnant, or if you've got a weakened system from illness or medications. How you get it? It comes during a 1-dose shot, given by your doctor.
Don't forget to subscribe, activate the liking bell, and share.